Welcome to the second seminar in this series on addiction. Today's seminar is about stimulants, including the drug ice. My name is David Outridge. I'm a medical addiction specialist, and the objective of this series is to train parents and friends of loved ones who may be suffering addiction to assist them in helping their loved ones. I want to acknowledge Community Drug Action Team Port Stephens, the Samaritans Foundation, who I work alongside, and also Raymond Terrace Public Library for kindly hosting this series. We'll look at an overview of substances that are abused, the trends in amphetamine use, the effects of amphetamines and how they're used, and then the best evidence about treatment for amphetamines. This shows 5 groups of commonly abused substances, and the first group is stimulants, which includes methamphetamine and cocaine, but stimulants can also include milder stimulants such as caffeine. These drugs tend to make the nervous system more alert and aroused, and the colloquial term is uppers. The next group is the opioids, which include heroin, OxyContin, codeine, morphine, buprenorphine. These drugs produce pain relief, but in excess cause euphoria. The main danger with these drugs is death by overdose due to suppression of breathing. They also can be termed downers because they produce a degree of sedation. Next group is a commonly used party drug called ecstasy. Essentially, these drugs are called bonding drugs. They tend to release oxytocin and produce a sense of bonding amongst people, say at parties and dance festivals. They do have a certain stimulatory effect, and unfortunately what's marketed as ecstasy often contains stimulants. There is a degree of stimulation effect from ecstasy though in its own right. Next group is the hallucinogens such as LSD, magic mushrooms, PCP, and other various substances. Both these party drugs and hallucinogenic drugs have membership in the group called novel psychoactive substances. That is, there are a number of new substances coming out which have various effects, including hallucinogenic effects, stimulatory effects, and these drugs simply are an unknown quantity in many ways. The next group is the sedatives. These produce suppression of the nervous system or sedation. They often produce lack of inhibition due to suppression of the frontal lobe, which is the smart brain or the inhibitory part of the brain. And this group includes alcohol as well as benzo group of drugs and the old barbiturates. Alcohol also has some effects on the opioid part of the brain. That is, it causes release of endorphins. So, and many of these substances do cross over into other groups. Cannabis fits somewhere between the sedation and sedative group and the hallucinogenic group, and it also has other effects such as anti-nausea and some pain relief in its own right. So methamphetamine use and problems arising has been trending upwards since about the year 2000. This shows one aspect, which is the arrests for possession, trafficking and dealing, and apart from a small dip around 2009, 2010, it has been trending upwards. This shows results of a study looking at overall numbers of people who may be using methamphetamine. On the left, people who use up to monthly, and there's about 250,000 in year 2014, and as you can see, there's that dip again around 2009, but overall it's trending upwards. The number of addicted users, and we'll look at that later, what that means, is around 150,000 by 2014. Again, this is still trending upwards. The blue line is the average, and the outer lines are the confidence intervals. The analysis of wastewater or sewage water it also gives us an idea how much amphetamine is being used. The open circles are regional areas, and the solid blue dots are the urban areas. The urban areas tend to predominate more with cocaine, therefore the amount is smaller, and it works out that in rural areas there are about 25 to 50 doses per 1,000 population per day, which seems to fit in with an overall population rate of around 1 to 2% of people who are using fairly regularly. This is a statewide interstate comparison of trends in wastewater methamphetamine, and it does show that in most areas it's still trending upwards. This is data from 2016 to 2018. Particularly in South Australia, has very high levels. So why has methamphetamine or ice become so big in the last 20 years? And it's hard to say exactly, but it seems that during the 90s there was a major opiate push by drug syndicates, and it became almost like a change of the business model. And methamphetamine can be manufactured in Australia. It's also highly addictive. It goes to the core of people's reinforcement centre in their brain. It doesn't tend to kill the users as readily as, say, heroin does. It's vaporizable, which makes it appear less dangerous to newcomers. That is, they're not having to inject, but it still gives very high levels in the brain, which is very addictive. It's extremely potent compared to the old speed, which was around for many, many years, which was a mixture of amphetamines and usually lower potency, say 10 to 15%, whereas ice is around 80% pure. It's relatively cheap because it can be manufactured from local ingredients, not dependent on bringing things in from overseas, such as heroin or cocaine. It is very abundant. International movements of cargo and passengers is very common these days, making it easier to import. And it suits a wider variety of people, including people in the workforce who have to perform intense physical tasks, such as concreting, that kind of thing, mining work. It's also used to enhance sexual performance. It's often used by students to study, by housewives to get their work done, and that kind of thing. So it's got a wide appeal. How common is ice addiction? Amongst adults 15 to 54 years of age, there appears to be around 2% of the population using it regularly. That is about monthly or more often. And about 2/3 of those are actually addicted, that is, are having problems with controlling their substance use, problems arising from their substance use and craving. Australia has amongst the highest rate of methamphetamine use, with 10% of adults having ever tried or used methamphetamine. Regular use has increased. Addiction develops in about 1/3 of repeated users, and whereas addiction with speed used to take a few years to develop, addiction to ice can develop after about 3 months of use, and it's more common with people who use heavily, who use direct routes such as intravenous or inhaling, or people with coexisting mental health issues. We'll just take a pause here, and in the next part of this talk we'll look at the effects of the drug ice on the brain and the body.